nurse today. Hand sanitizer. Can you please verify your name and your date of birth?
Cameron 08/28/1996.
Okay. And do you have a preferred pronoun that you go by?
Him.
Okay, perfect. And do you have any allergies?
No.
All right. So today we're going to be performing a focused respiratory assessment. It'll take about 5 to 8 minutes. Do you understand? Patient understands the assessment. I'm going to give you this gown and pull this curtain tube. Okay, are you comfortable?
Yes.
Patient is comfortable in regards to warmth and privacy. Okay, so we're just going to put this pulse ox on your finger. And I'm going to take your respiratory rate. Just sit still for me. Okay. Respiratory rate is 16 and pulse ox is 98. Okay, so do you have any coughing? Do you have any shortness of breath? No? Do you have any current or past respiratory illness that you're aware of? And have you ever been a smoker? Okay, perfect. So I'm just going to go along and palpate, and every time I move my hands, say 1, 2, 3, okay? So just from appearance, we can say the thorax is symmetrical. The costal angle is less than 90 degrees. The ribs are palpable and symmetric as well as sturdy. And the muscle development seems symmetrical as well. Okay, so as I go down, just say 1, 2, 3.
1, 2, 3. 1, 2, 3. 1, 2, 3.
Okay, so in terms of vocal firmness, the vibrations are palpable, symmetrical, and bilateral. Okay, I'm just going to have a look at your trachea. So just relax and put your head down. Okay, so the trachea is midline and slightly movable. Perfect. Okay, now I'm going to have a listen. So every time I move my stethoscope, just take a deep breath for me, okay? In through your nose, out through your mouth. Okay. All right. So there are no vesicular or advantageous sounds on the anterior part of the lungs. Okay. Now we're going to move to the back, and I'm going to do the same thing. First, I'm going to assess for any tenderness. If you'll just lean forward with your back, please. Okay. So as I go along, just the same thing. Do 1, 2, 3. But also tell me if there is any sort of tenderness or pain. Okay.
Mm-hmm.
Say
1, 2, 3. 1, 2, 3. 1, 2, 3.
Perfect. And any tenderness?
Mm-mm.
Okay. So the patient reports there is no tenderness on the spine, the vertebrae, as well as the posterior thorax. The posterior thorax is symmetrical. The scapula are symmetrical. The spine is straight. The ribs are sloping downward at a 45-degree angle. There was no, and now we're going to assess the lung sounds posteriorly and laterally. So same concept as before, just take deep breaths every time I move my stethoscope. Okay. So there are no vesicular or advantageous sounds laterally or posteriorly, and no tenderness was noted. Real quick, in the front, the clavicle bone is symmetrical. Had to come that one out. And the muscle development on the back is also equal and symmetric. Okay. All right. Do you have any questions?
Mm.
Okay. Thank you. And I'm just gonna do a flip of the room one more time.